This podcast is brought to you by Podcast Nation.
You are listening to As a Woman, episode 97, Postpartum with Dr. Mommy MD. In this episode, we are talking about being physicians and being new moms and the struggle that it is to adjust to the fourth trimester for all moms everywhere and what we can do about it.
Welcome to As a Woman, the podcast hosted by fertility physician Dr. Natalie Crawford to educate and empower women. Each week, learn about your health, your fertility, and how they relate to your true self. Become a part of the community fostering collaboration over competition while learning how to authentically find your voice and amplify others as a woman.
Hey friends, welcome back. Today I am talking with Dr. Michelle Rockwell. She goes by Dr. Mommy MD in all of these social places, about what it is like adjusting to new motherhood, especially as a physician, because that's our experience. This topic is very near and dear to me, and the reason why I want to start this discussion is that so many of us are not prepared. We don't know what to expect, we suffer in silence, and we don't know what is normal. And you know I've said it before, if we don't know what's normal, how do we know what is not? It is okay for this transition period to be hard, and it is okay to get help. Shelley is a family medicine physician. She has extra trained in a fellowship in sports medicine. She is married to another physician, and she is a mom of two. You are going to love how she is shifting her focus as a family medicine physician onto helping moms in this postpartum time, and I'm so thrilled to have her on today.
All right. I am so excited to have Shelley here. Shelley, thank you so much for coming on the As a Woman podcast to talk with us today.
Thanks for having me, Nat.
So I want to start by just having you tell everybody, how did you get into medicine? Why did you pick medicine? Did you always want to be a doctor? Where did this come from for you?
So, not at all. Nobody in my family is a physician. Actually, my dad is the only person who went to college. And I actually thought I was going to be a teacher, which, I went to NYU. I was an English major. I thought I was going to be an English professor. And then I realized that my life would consist of reading Shakespeare every day and talking about the same thing year after year. And I didn't see fulfillment in that. I wanted to be doing something that would move the world forward, come up with new research, help people. And so I actually had heart surgery when I was a junior in high school and had a really, really good relationship with my pediatric cardiologist. And that's kind of what planted the seed for me to become a doctor. So I thought as a physician, I could be like a teacher because most of your job is education.
Right? Yes.
And I could also do research and I could help people all at once. So that's kind of where I took a turn.
So you were in college, right? When you kind of made this decision. So you were already on English major path.
I was like the end of my junior year of college. So people out there, you do not need to know exactly what you want to do with your life. You can always make a change. And I was like trying to figure out how I could fit in all of the prereqs for med school in my senior year. And it was just impossible. So I ended up doing a post-bac pre-med program at Columbia, which was a 2-year program. Studied some orthopedics there because you have to do like a lag year. So I did research. And I thought I wanted to be a pediatric cardiothoracic surgeon.
That was the goal.
Yeah. So with my history, that's kind of where I thought I would end up.
So you were interested. So this is fascinating to me. One, I like you don't have to make your whole life planned, when you're 15. You can definitely decide once you're already on one road, you can change. And two, it is totally fine if the process may take you longer than your peers, right? You took a couple years because that was just the road that was the best to get you into medicine. And
yeah,
then
I ended up being like 3 years behind everyone else.
3 years behind. And then when you were in medicine, so once you're in medical school, you're going down the pathway thinking, I want to do pediatric cardiothoracic surgery. And when did that change? What happened there?
Yeah, it's really crazy. I mean, I was gung-ho about it until during rotations I had my surgery rotation and I absolutely loved it. And I still thought I was going to do that. I was shadowing one of the only female pediatric cardiothoracic surgeons in the country. I was in the OR all the time. And I loved everything about it except for the fact that they were never home and you're getting called in all the time. And I knew I wanted a family, and I know you shouldn't make your decisions based on that. And I don't think that I actually did, but my next rotation was family medicine, and I went into that thinking, "Oh, it's just gonna be 9 to 5, weekends off, it's gonna be so easy, like, who cares? Just like an easy rotation. I'll get what I can out of it and move on." But I ended up loving it, like, totally unexpectedly,
So
and
just
I was
out
like,
of the
"Well."
blue, yeah, you do family medicine and you see people in every stage of their life, and you have to know like the most of any physician, and something about that really resonated with you.
Yeah, I loved that you could do procedures. In my school, we actually did a lot of uh, like mom and baby care. And so I got to see a little bit of everything. And I was like, well, if there's something I love just as much, if not more, than surgery, and it has a better lifestyle, then why not pursue that?
Have you gotten any of the rhetoric that at least went around when I was in medical school about family medicine being looked down as a medical specialty?
Yes, like big time. It was a really hard decision for me to make because I feel like I kind of had to swallow my pride in a way because wow, like you say pediatric cardiothoracic surgeon and everyone's like, "Oh my gosh, like that's amazing." And then you say family medicine doctor and it's just like, "Oh, cool, you're a doctor."
I have no idea why this is, to be honest. When I did my family medicine rotation, I was like, wow, I don't know that I could do this because it's so hard. It really is having a lot of different skill sets relating to a lot of different types of people, needing to be able to communicate and educate at all different age points, being up to date on everybody's different needs. It felt like a huge amount of information and then upkeep to do it. So but I knew that. I knew the people going into family medicine, and I had friends who were family medicine residents, and there was this, I don't want to say stigma, but there was just this thing that it was, oh, the easy peasy residency, which I have no idea where that really came from. And I think social media has done a really great job of showing family medicine physicians who are doing really amazing things and what the field really is about. Do you feel like social media has helped in any way kind of share more light to family medicine, or maybe you feel the opposite? What's your thought there?
No, I definitely agree with you. I feel like in family medicine, what you said is exactly true. We have to know, a little bit about everything, and we get to see all types of people, literally cradle to the grave. Um, but what I find most fascinating about it is how everyone finds their little niche, and everyone has such passion for some kind of sub aspect of it.
I
And it
love that.
allows you to do so many different things. I mean, there's so many fellowships, there's sports medicine, you could do ultrasound, you could do adolescent medicine. So, and you could do geriatric medicine. I mean, sleep medicine. I don't even know. There's so many. I can't even keep track. But you could really kind of subspecialize too, which is what I ended up doing.
So you ended up subspecializing in like orthopedics, right? Or sports
Mhm.
medicine.
Sports medicine. Yeah.
So
So
what drew you into that lane? Because you're kind of creating a new one now from there.
yeah, yeah. I've been all over the map, but really, sports medicine appealed to me because of the amount of procedures you could do. So I felt like I still had that surgical aspect of it. I did a lot of ultrasound guided injections. I did spinal injections. So, so I got to have some procedure days and some clinic days, and it really varied what I was doing from day to day. And I also really just love kind of like the pathophysiology of musculoskeletal issues and how the body moves and works. So that was really interesting to me.
When in this process did you have your kids, or did you start trying to have your kids?
So my husband and I met during my fellowship year at University of Utah, and he was my CrossFit coach.
I love that. I don't think I knew that.
um, but so we ended up after my fellowship year, well, during my fellowship year, we did a year apart. And so he moved for medical school and I stayed for my fellowship. And then I ended up moving out to Virginia where he was in med school and I got my first attending job at a Division 1 school, Virginia Tech.
So cool. So did you know when you met him was going to medicine part of his plan, or did that happen over the course of your relationship?
Kind of. So he actually had applied to medical school twice already, um, and didn't get in, but he was in the process of applying one more time, and he actually got into a post-bac program out in Virginia that you're guaranteed entry into the school if you got, like, a perfect GPA.
That's really cool.
So he
So
was definitely pursuing it.
suddenly here you are, you're in your training. So you are one of the people who, I love this part of your story, said, I want to pick a field that will resonate with me being able to have the life I want to have because I want to be a mom, but I'm not with a partner at this time period, right? So we are
No, yeah.
planning for our future, yet it's so undetermined. Then you find a partner, and then it turns out you get to be like a two-doctor household, and you're having to like plan your career along with someone else's training, which is incredibly difficult.
Yeah, it's been pretty wild because, when I was in fellowship, I still really loved sports medicine, even though I encountered a lot of, sexism and misogyny. And it was really hard for me as a female in sports medicine, especially with like a Division 1 football team. Um, I still really liked it. I really still loved working with the athletes. But when it came to the fact that we were going to be moving so frequently, and then also, again, planning for a family, it just didn't seem like the right career for me in the long term because sports are, 24/7. It's all weekend, all evenings. You're on call all the time. Whenever those athletes need you, you better be there.
Yeah, and there's
So,
no off season because you're
no.
training and you're in camps, right? So it's
Mhm.
always on, and it's a really neat profession, I think most people think
Yeah,
it's
it's
really
awesome.
cool, but it is something that you've gotta really, I think, be committed that that's your true passion to make it worth what it's going to take from a sacrifice stance, which if that's your true passion, that's awesome. But you started having inklings that maybe it was something you were good at and you really liked, but that your true passions in medicine may lay somewhere else. Did this happen over the course of you being pregnant and giving birth? Or when did you start thinking that perhaps your spot in medicine may be more in the, mother, baby, newborn, postpartum time period?
Yeah, so when I got pregnant with Mason, it was my first year as attending. Actually, it was on my honeymoon or a couple days before. Um, but that's when I started kind of being on social media and started my page, Dr. Mommy MD. I kind of started that as a way to connect with other moms because really, I'm an only child. I'd never really been around babies or kids other than taking care of them in my clinic. So, I wanted to learn more about motherhood myself and connect with other moms who have been through it before. Kind of also wanted to like journal almost about what I'm going through and the whole process. Um yeah, and so just during that process and having Mason and realizing how much harder it is to become a mother and just motherhood in general than we're led to believe in a way is kind of what made me want to just take care of moms and babies for the rest of my life.
I just resonate so much with this because here is, as I was in the position, I was a, infertility fellow when I had my first child. So I'd gone through all of OBGYN residency. I felt like I was, the pregnancy birth expert. Like I had held thousands of babies in their first moments of life. I knew how to swaddle them like a pro. And I had no idea what to expect. Even in my pregnancy, I found myself like researching in these non medical sites and these forums, trying to figure out, is this normal? Is this not? And then kept feeling like, isn't this so strange because I'm OBGYN, yet some of these things that are not necessarily medically related, we just don't talk about. And then when I had Campbell, I was like, I didn't have any idea. I didn't know how to breastfeed. I was so unprepared for what to do with her. I really remember Jason and I looking at each other when they were like, hey, you're doing great. And it's like post op day 2. Do you want to go home? we're like, okay, sure. And then we get there, we're like, what on earth are we doing with her? And
Yeah.
we ended up with, she was growth restricted and she wasn't eating enough. And I was trying to, I was really, I loved UNC, but it was a very heavy breast is best hospital. And like they didn't even have formula to offer you. And I think I felt such immense pressure that I am type A and I was going to breastfeed no matter what, that I didn't even realize she was not getting enough till we started taking her to the pediatrician and she was losing weight. And there's just so much pressure in that new mom period that nobody talks about. And I didn't feel like I had the forum or the resources to say, hey, what's going on and what's normal and how do I do this? This was way before I was on Instagram. So I love and I totally feel like I know, like I'm your clientele, like I am your person because I was that person as well when I went through it. And if we are two physicians sitting here feeling this way, highly educated people, that imagine somebody who's got no training in the human body or what's normal or what's not normal. I really feel like there's so much work to be done in that space.
Yeah, I feel like, after I had Mason, or even before so, I started reading all of these books like what's the best schedule to have your baby on and like all these breastfeeding books. And after I had him, like same thing. I remember just sitting on the couch scrolling through like textbook after textbook on, how to do it the quote right way. And there is no right way really, but
It's so stressful. I'm just sitting here thinking about the schedule, feed and this and sleep, or when do you do play? And it, especially for somebody who's got very limited time in that recovery period or, that maternity leave. I don't know about you, but I had very little time and it just felt like there was more pressure and more stuff to get done.
Yeah, I
You,
also feel like at that time period, I mean, that was like 3.5 years ago or so. I still feel like social media was like focused on this like totally beautiful, like postpartum period where everything was perfect. Your house was spotless. You did the dishes, you cooked. Like it was still just that kind of fantasy world of what it should look like in motherhood. And I'm pretty grateful to say I feel like now things are better and getting better and people are more honest about it even though social media is still, a visual platform and people like to make things look pretty. I think that they talk more about kind of the nitty-gritty stuff of motherhood.
I think so too. I mean, I feel that way about social media in general. It's not perfect. And yes, at times it's a highlight reel, but I feel like there's a lot of people talking very transparently about, negative things and real life stuff. You have been open about your journey with postpartum depression. When, what was that like for you? What's your story? And did you even realize that's what was going on when it was happening?
Yeah, the crazy thing is I'm a physician and I did not realize that that's what was happening. I didn't know that like my feelings weren't normal because it was the first time I was a mom. So I thought, oh, I'm just tired. Oh, life is just different. Oh, it will get better tomorrow or next week or next month. And eventually it just never did. So I feel like at the beginning, things weren't that bad. Tyler was home with me for the very first month. And he was what was he, a fourth year medical student? And so he ended up going away for 5 straight months of away rotations, and I was
Oh my gosh.
basically at home parenting by myself for the very first time. And no fault of his, it's just the way that it was, and it was just, that part of our life, and, I was really lonely, I was really overwhelmed. I'm very type A, as many of us in medicine are, and you know, having the house messy stressed me out and gave me anxiety, and I would just cry, and I felt like I wasn't present with him, and I knew, like, in my heart that I shouldn't, like, feel so sad, but at the same time, I felt, like, guilty to admit it almost because so many women, like, and even friends of mine were struggling with either miscarriage or infertility, and I literally had, like, everything I ever wanted. Like, I had the best husband, we had a beautiful home, I had, like, a great job, I was finally a doctor, like, finally all these things were happening, but I wasn't happy.
It feels like that guilt just compounds itself, right? Because you get into this cycle where you can't win,
Right.
because you then are beating yourself up over how you're feeling instead of maybe saying, oh, this is something that happens to over 15% of new moms. And when I think about statistics, I think about this with infertility all the time. More people are talking about infertility. The stigma is starting to go down there. I feel like the stigma is still super high for postpartum depression and anxiety. And when
Hmm.
you think about, 15%, one out of every 6 to 8 of your friends is struggling with something, yet how many people are being open and honest about what it is? And that's really tough. And the thing I say about to my infertility patients is, you have a world of people that want to help you, but if they don't know you need help, they're not going to be able to. And so admitting it to yourself and being open with other people is the best thing you can do for yourself. But we feel this desire to say, no, I don't need help. I can do it. This isn't how I feel. How did you start to recognize what was going on? How did you get help, or what do you wish you could go back and do different?
Yeah, I feel like that's something I very, very much struggled with because I am really strong-willed, really stubborn, and I definitely feel like I should be doing everything on my own. And so asking for help in the first place was probably the most important thing that I learned. Even like if I needed to take a nap or take a shower, I felt so guilty to like ask my parents to come over, ask a friend to come over. But as moms, like we just don't have that village necessarily that we used to have. And we're expected to do everything on our own, but we shouldn't have to. And, if you're overwhelmed or if you want to sit down and eat your lunch without a baby in your lap, it's okay to call a friend and say, "Hey, do you wanna come over, bring lunch, and hold the baby for a minute while I eat?" Like, just those little things that other people would be so grateful to be able to do for you, but kind of, I don't know, just having the willpower to actually ask for it is the hard thing.
What do you think about in a COVID world, how we can encourage women to get help when they're feeling isolated and alone? Because I love what you said, and I definitely didn't do that, even though I know there were people who could have come and helped me. I really felt this strong, I don't even know that it was a conscious feeling, but this subconscious feeling that I could do it. So many other
Mhm.
people had done it. I
Yeah.
could do things and I could get through it. But I don't know, what do we tell women right now where it's not really the world where you can maybe call your neighbor and say, "Can you come help me?" Or how do we help support women, who are struggling with, maybe it's finding a community, maybe
Yeah.
it's with other resources. What advice do you have for those women?
I feel like that's really hard because physically it may be difficult or even impossible for someone to come over and help them. Um, but also as like a first time mom, I remember like I would not let Mason cry for like more than a second, like out of my arms before I like needed to pick him up and comfort him. And not to say that I just like leave Parker willy nilly, but it's like, well, if I need to like take the clothes out of the dryer and he is upset for 5 minutes, like it's okay. So I think that that's a really important thing to remember too. Like your kids are going to be okay. Kids have been left, in worse conditions. Not saying that you should just leave them alone forever, but if you need to do something, if you need to eat, if you need to take a shower, like, put your kid in a laundry basket outside your shower and take that shower, like, where you know that they'll be okay and take that 5 minutes for you.
Yeah, that bouncy seat situation. I don't feel like I
Yes.
really utilized that enough where you can strap them into a safe spot and
Hmm.
they don't have to be constantly, entertained, or you can still supervise them while you wash your hair, because something as simple as washing your hair can make you feel so much better. What other things do you think in that initial postpartum period that we see new moms struggling with that we don't talk about enough ahead of time?
I mean, I really do feel like it's kind of like those basic needs, like making sure you're drinking enough water, making sure you're sleeping as much as you can, eating. I mean, I I feel like I hardly ate ever because I was making sure that my baby was fed and that other things were done, that I would hardly ever sit down for a meal. Taking a shower was like the biggest luxury ever. Or just getting out of the house, like sitting outside. I realized when I had Parker, that's something that really made me feel better, just to be outdoors. So with him, I would just sit outside with him while he napped instead of sitting inside. I feel like there's little changes that you can make that can make all the difference in your mood. And they're very doable with babies if you pay attention to those things that make you happier, bring you a little bit of joy.
I agree with you completely. And I feel like I know what your answer is going to be here, but what is your take on the, you know, breast is best? I feel like social media has actually made this worse in a way because
Mhm.
it has started in a maybe a grassroots good effort to say you should be able to breastfeed anywhere and let's normalize breastfeeding, which I'm a huge proponent of. There's also some associated societal pressure that if you're not breastfeeding, you're not doing it as well as other people. So, as a physician, as somebody who's specializing in this, mommy baby postpartum period, how do you counsel patients on should I breastfeed or breastfeeding's difficult or what to expect when breastfeeding?
It is way harder than we're led to believe. Way, way harder. This is one of the main things that I struggled with Mason too. We went to lactation consultants. I had pain. I ended up finding out I had a vasospasm. And, thinking about it, I think, he probably had tongue tie and all these things. I had so many issues and I was crying all night because I felt like I wasn't giving him enough milk. And I think to a point, of course, like breastfeeding is great. It's healthy for your baby. They get many benefits from it. But if it's compromising your mental health, then in my opinion, it's not worth it. Just do what you can, do your best. And if you're done with it, then that's fine. And that's great too. I think it's really good to be able to make that decision for yourself.
Yeah, I think we still have work to do on that arena by just supporting moms and understanding that in that new mother period, you are the one, you have to put on your own air mask first, right? And I
Mhm.
don't think we give new moms enough grace to say that this is going to be a very difficult time. And it's not all about losing your baby weight and getting your baby body back or whatever, because I do feel like that is this other huge pressure. You need to and if you're a professional woman, you've got to get back to work, act like you didn't have a baby, look like you didn't have a baby, never talk about the baby, find time to pump for the baby, but don't compromise your clinical care. Don't cry because you missed the baby. Still go home, still answer emergency calls overnight, get to the OR on time. I mean,
That's
it's like
crazy. Yeah,
it's
it's
like
so
have a
much.
baby, but then come back to work and act like you didn't have a baby. I feel like that is the message that I got when I was doing this. I know so many other professional women, not just medicine, but overall, you're suddenly supposed to go back and be normal. And you have this very short leave, and it's this immense amount of pressure. We are set up to fail, don't you think?
Yeah, it's really, really sad. And I think just recognizing that and saying it out loud and, the fact that women are talking about it more and more and talking to each other about how much pressure they're feeling, it really does help. So it helps you recognize that you're not alone.
What do you want to tell new moms as far as warning symptoms? Let's say if you are feeling X, Y, or Z way about whatever, you need to do something. You need to call your doctor. You need to reach out to somebody. This is not normal. So, where do we say maybe it's different between I'm feeling new parent stressed because obviously that's not going to be just like a walk in the park versus hey, I think something more is going on. What do you tell somebody these are the things to look out for or when you need to reach out for help?
Right. So if you look at it in the textbooks, it's really easy to tell. But in real life, for me, it was hard. Technically, like baby blues shouldn't last more than 2 weeks. But your exhaustion as a new parent is going to last, for many years. Uh, so for me, I would say, if you find yourself, crying a lot, feeling like you're not good enough. For me, I also had anxiety. So I felt the need to control a lot of things like weighing the breast milk that I was putting in the freezer every day to like say exactly how much I had and calculating how much I needed to get him to a year, like different things like that. Um, and I think another thing people don't talk about a lot is like anger or rage, like not like you're gonna hurt your baby rage, but just, being angry at your partner or snapping at them, being resentful of your partner, when they're sleeping and you're breastfeeding. These are all kind of signs that things, are not going the way that they should be. And I have to say, like, I actually started medication after having Parker. I did not with, my postpartum depression with Mason. And I didn't even know that you could be this happy before that. Like, it was like a switch was flipped. And I'm on like the lowest dose of Zoloft, just a tiny amount. And it changed my life. And I feel like so many people are very hesitant to get on medication. And I mean, it took me 3 years really, to do it. I mean, I did therapy after Mason and it helped a lot, and I think time just helped. But really medication helped me so, so much. And so if anyone out there is hesitant about it, just give it a shot. It doesn't have to be forever. If you hate it, then you could stop.
I think that's so empowering though to say, hey, I'm on antidepressants and it helped me.
Right.
It's not something to be stigmatized as much as it is. It's a very hard time period and there's so much going on. It's not just a one-way street. So, especially when you're getting pregnant with your second, then you have another baby to care for. It's not like you can say, I'm going to sleep when the baby sleeps because you have another
Right.
child that needs, and I found that's when I really struggled was with Rhett because I didn't know what to do with Campbell. But then when I had Rhett, there was no downtime. There was no downtime at
Mhm.
all. And even though Jason's amazing, I made him, I mean, he would get up when I breastfeed just to see if I need anything. And he was so helpful. But when you have two, it's like you have to, and they're very close in age, you have to split them up.
Yeah, you're
He'd be,
tag teaming.
we literally would have like, he'd have Campbell's monitor and I'd have Rhett next to the bed. And you just are trying to make it work. And so that was like a whole nother dimension of difficulty adding in, another child. When, I had C-section. So I had C-sections with my kids. And despite counseling patients as a woman who has done C-sections on bajillions of patients about when they should expect to feel normal and start to be able to exercise, I found it so hard even to go on a walk, like the loss of core support. And that I think compounded like this extra negative body image because it's one thing to
Mhm.
gain weight and be pregnant and you can say, oh, it doesn't matter. I'm doing this for the baby. But then suddenly this postpartum, I wasn't sleeping. I was having a hard time breastfeeding. I wasn't confident in what I was doing. And then I really didn't feel like myself. So I felt this extra drive to lose weight or get in shape, but I couldn't because of the C-section situation. And then when I started to even be able to walk with the stroller, it was so hard. How do you try? And I wish somebody in hindsight had said, please focus 0% on losing weight at the current moment. Just
Yeah.
literally, like, don't let that thought enter your mind. I understand your body image that you don't feel like yourself and you're not going to be yourself. Your body's going to heal and just focus on trying to understand your new routine. Nobody said that. And I felt that pressure, maybe just from society or from everybody. What do you tell people about when they should start to incorporate exercise back or start to feel like themselves or losing the baby weight? Kind of your approach to all of that stuff.
Yeah, I also just don't ever want people to focus on losing the baby weight. For me, it was more, getting out and getting my body moving really actually helped my mood. Before I had Mason, I was doing CrossFit like 3 to 4 days a week until literally the day before he was born. And I also had two C-sections. And I was definitely not prepared for the difficulty I would have returning to exercise after my C-sections. Everyone's like, "Oh, 6 weeks postpartum, you'll be good to go. Just get right back into it." And 100% that is not how it was. I did not feel comfortable, like, doing a push-up or anything until, like, 3 or 4 plus months afterwards. I actually, like, forced myself to go on a walk maybe it was, like, 3 weeks after having Mason, and I went with a friend. We ended up walking maybe 3 miles on accident because we were just talking. We both just had babies, and I regretted it so much. I bled and bled and bled for, like, 2 weeks after that. I was in so much pain after my C-section, and I was just, like, so hard on myself thinking I could just be exactly the same as I was right
Yeah.
before this all happened. And that's just not the way it is. Like, your body has to heal. It's been through so much. It birthed a baby, like a human being. um,
And
so
it's
I
a
think just
major surgery.
wait. Yeah.
A C-section
Yeah.
is a major surgery. We just diminish it so much, I think, especially in this country. And not really purposefully, but we do, to the thought that you should just be able to get over it and get back. And I remember we got a jogging stroller and I kept being like, when on earth will I jog with this child? Because just pushing it and just standing straight up and down and pushing the child is tough. Like, I'm actually supposed to like run and push this thing at the same time. I think that took me like
Yeah. I
months
never
and
ran with my
months.
jogging stroller.
Oh my
Not
gosh.
once.
And it's like, I was like, I just felt like I was so, misguided in what my expectations should be in that period.
Yeah, well,
And
I mean, we see like so many people like, which I mean, I think it's great for women to get back into their fitness, but when you're on social media and you see people working out and saying, "Oh, I'm losing the baby weight," or "I'm doing this program or that program," but you don't know like how far postpartum they are. You're not thinking about that. You're just thinking, "Oh my gosh, I should be doing that," even if you're, just 6 weeks out. And they might be 6 months out, they might be 9 months out. So, I feel like there's just this comparison game, and it's really hard, to just be almost, just be in your body and yourself at that time.
I completely agree. I think the comparison game is high across the board for all women, but I really feel like there's this extra interest in the postpartum period. There's so much algorithm push when you started saying like, here I am pregnant and here I am not pregnant, or 9 months in and 9 months out. And I want to tell people, man, at 9 months out, you should not be back to your normal self. Like, you are adjusting life, and you're going to be a new person. You're growing into a better person. You're not supposed to get back to that person you were before. You're going to be different. I want to ask you before we get off, this has been a crazy year, right? And the past 10 plus months have just been outrageous. You have been seeing COVID patients, you've been isolating, you got pregnant, you had a miscarriage, you had a COVID, you had a DNC, you've gotten vaccinated. This has been a really crazy year for you, right? I mean,
Insane, yeah.
for everybody, but what are kind of your thoughts, or what do you want to share about your experience for people who don't know it, about your decision to try to get pregnant during a pandemic, and thoughts on miscarriage? Was this your first miscarriage that you'd had? Or, you were so open and honest about it. And I just want to commend you for that, because that's something that there is still too many people who are just suffering really silently about. And, you were all over social media being so upfront and honest. It was so vulnerable and beautiful. And I know that you're helping more people by sharing that side of you. But what do you want to say about that whole story? Or what do you want people to know?
Yeah, this year sucked. I mean, there's no better way to say that, and I know, like, it sucked for almost everybody. I mean, everyone's been through some hard stuff this year, but for me particularly, it's been bad. Um, but I think that the one thing that I learned from kind of talking about my postpartum depression journey is how much sharing your story helps other people. And I knew from the moment I got pregnant that I wanted to, share the news with everybody, whether, things would work out good or they would not work out, because if they didn't, then I might help somebody else or might help somebody not feel so alone. And the amount of messages that I got from other people saying, "Oh my gosh, like, I was also just had my ultrasound and we were measuring 2 weeks behind," or, "I had just lost my baby too, and I haven't told anybody that I was even pregnant, and I don't know who to talk to." Like, that stuff just, you know, in one way breaks my heart, but in another really justifies my why as to why I'm in this space at all, is to show women that they're not alone and that other people have, like, walked this path before them. So, I mean, in December, I lost my baby and then I got COVID, and I realized I needed a DNC, but I couldn't get one because I had COVID, and so
Same.
no one would see me. And so I had to sit there knowing that, my baby wasn't alive for 6 weeks.
It's so unfair. I mean, on so many levels, but when you talk about, and I feel like you've suffered from this pandemic so much because, you know, your hours got insane trying to take care of COVID patients. You weren't able to see anybody and get help that you needed. And then this part of, it's like not the icing on the cake, it's like the straw that broke the back. Here you are experiencing something that's extremely traumatic for everybody. When I've been there, it's terrible. And then knowing you need this procedure, yet you can't have it because of COVID, and yet risking your health, risk of infection, and just mentally wanting to get to that next stage of the game. I don't know how you did it, Shelley. I love you so much. And I think that that strength really is inspiring more people than because we are seeing people who need procedures put on hold because they have COVID, or surgeries are canceled, and it really starts to push the line on what is elective and what's not elective, right? And
Yeah.
I don't know. I just want to tell you that from my standpoint, you're amazing. And I really do think that you are braver than I was. When I went through my miscarriages, I didn't tell anybody. I didn't tell anybody. And I was in, just like you said, people online. I hadn't told anybody I was pregnant. How was I going to tell them that I had lost the baby? How was I going to get any of that support? So the fact that you've been so open and honest with your story, I think is showing this is real life. This is what you go through. This is how things are happening. And even worse, this is real life in a stupid pandemic, right? Where are you in this process now? So you're healing up from things. And, I know you're about to take kind of a career transition. You want to tell us some of the exciting things that are coming for you?
Yeah, so I am really excited. I spent my 10-day isolation we're in a hotel room by myself, away from the kids, because
Oh,
there's no way they would leave me alone in my house.
right.
It was really hard to be away from them, but I tried to make the best of it. And I worked on my online course, Mastering Motherhood. And really, my goal for this is to just kind of distill down all the information that new moms need for that first year, whether it's about breastfeeding, bottle feeding, pumping, sleep, just like their general health, doctor's visits, packing your diaper bag, all that stuff. There's so much misinformation out there, or just too much information out there, that I kind of want to package it really nicely for new moms so that they're not so overwhelmed. And so that I've kind of pre-released it this week, but February 15th is going to be the big release day. So it's coming.
I'm so excited. Before we get off and you tell everybody where to find you, I just want to say I remember sitting with you by a pool in like February of, was it last year?
No,
Was it
2 years ago.
It was 2 years ago. It was right, February
Was
of
it
9.
Pinnacle or
No,
no?
it was like February of like 2019, or March, I don't remember. But anyways, and we were talking about what's going to happen in the course of our lives, and I had just switched jobs, and of course I've switched
Yeah.
again, and you were talking about this vision of what you wanted to do then. And I'm just so proud of you for saying this is kind of where you're coming, and you've been putting your heart and soul into this for so long. So you are going to change so many new mamas' lives by putting your truth out there and your knowledge. And I'm just so inspired by you. And I really hope everybody, passes this along to people who are, especially, new moms, or kind of at that juncture where they need more support and just want to have a community for this motherhood stage. Where can everybody find you? Tell us where all we can find you. And thank you for being here.
I am Dr. Mommy MD everywhere, doctor spelled out. And that's my website too. So I keep it real simple for you.
I love it. Okay, Shelly, thank you so much.
I love you, Nat.
All right,
Bye.
bye.
Huge thanks to Shelley for coming on and being really vulnerable and sharing part of her story. I also want everybody to know that it's okay to need help. It's okay to ask for help. We're going to be diving into specifics on some of these topics even more in the upcoming year, because I think that the postpartum transition is something that we don't talk about enough as women. And you know me, I like to break down the stigma and talk about those hard things because I've been there. I had no idea what to expect. The transition, especially as a working mom, was so incredibly difficult. And the reality that I was expected to show up back at work and act like I hadn't undergone this major life transition was truly shocking to me. I want to thank you all so much for all of your love and support. You can follow me on Instagram at nataliecrawfordmd, or you can go check out the YouTube channel as well, Natalie Crawford MD. Thanks, friends.
My name is Len Webb.
And I'm Vincent Williams.
We'd like to welcome you to our documentary podcast, The Class of 1989. Over the course of 6 episodes, Vincent and I will examine the importance of 6 Black films that came out in '89 and how they shaped and influenced popular culture, filmmaking, and society in general.
Come on, sucker. Let's get it on.
New episodes will begin running weekly on March 6th.